Dave Galere, hello everybody, and thank you for watching this short video, which comes to you from me and from Mark Ward, who is our mental health spokesperson in the Oireachtas. And we want to talk to you about a motion that we're bringing forward on Wednesday about mental health. It's about mental health services, access to mental health services, and this motion is important at any time, but it's really, really crucial now because we know that people have really struggled and really suffered throughout the public health emergency. And we hear those stories all of the time. And we now know that now is the time for action, that we need an emergency intervention. We don't have so much a mental health crisis anymore as a mental health emergency. So this is your motion, Mark. We're going to have it before the Dáil on Wednesday, and it really is a crucial motion at this time, isn't it?
Absolutely, Mary Lou. And as you know, there doesn't be a debate in the Dáil that doesn't mention mental health, and there doesn't be a decision that's made at that cabinet table that doesn't have an impact on people's mental health, whether they're policy decisions on housing, on employment, on health, wherever it might be, it has an impact on people's mental health. Like, I spent today dealing with parents who are just trying to get access for their children for mental health services. It's absolutely heartbreaking to hear their stories. Every time they go to a door, the door seems to be closed on them, and it's really, really frightening. We also have, Mary Lou, as you know, there's an awful lot of people that are experiencing mental health issues for the very first time this time since the pandemic. We were in a crisis with mental health provision in this state before COVID. We're in an emergency now, and people are really frightened when they can't access service. If they can get the help when they need it, where they need it, it would make it a lot easier. But instead, they feel that they're fighting a system that doesn't seem to be moving anywhere. They're going on to lists that don't seem to be moving anywhere if they're lucky enough to get onto lists. So it's quite frightening. Like, over the years, the mental health services have been the Cinderella of the health services. The proportion of the budget has been slashed year after year. We're down to 5.2% of the overall health budget, where the World Health Organization recommends up to 10%. We see there's almost 11,000 children who are waiting for either treatment in CAMHS or in the public psychology system. There's 1,600 adults that are on that list as well. This motion that we're bringing forward is really, really vital, and it's really, really vital that people get behind this. Doesn't matter what political party you're in. It brings forward solutions that will help people in the here and now, but it'll also bring forward solutions that will have some long-term impact on how people can access mental health. Mary, you were with me when we went across the state, and we've done a number of round table meetings with stakeholders, but a lot of community groups, and the feedback that we were getting was the lack of access to services, and people really finding that it's very, very difficult for people that are accessing their service to find what was needed. So that's what we're calling for. That's what the motion lays out, Mary Lou.
And listen, we're aware that, like, this has been such a hard time for everyone, like for our older citizens, for people who haven't been at work now in more than a year, for people who have lost jobs, people who have been sick, people who have been bereaved. It's been really rough for our young people as well, hasn't it? I mean, it's just been the most extraordinary situation for young people. If you're 14 or 15 or 16, and even younger kids than that. So, and as you say, Mark, it's very striking that for some people, they're experiencing difficulties with their mental health for the very first time. For others, they've been down this road before, but either or. I mean, the idea of waiting and not being able to access the services when you or someone you love is in crisis is really, really terrifying, isn't it?
Absolutely, Mary Lou. And you mentioned, especially with young children, early intervention is key. If children get the treatment that they need, that they deserve, that their parents need for them, they're more likely not to need services as they get older. Like, parents shouldn't have to be out fighting for services that should be on their doorstep. They should be at home looking after their children as best they can, and they are, but that they're finding themselves caught up in bureaucracy, caught up in lack of services, and caught up in lack of access. So that needs to change. And this motion will lay out some things, and this motion will lay out things that will make that easier for parents to access services. But it'll also, as you mentioned, there's people experiencing mental health issues for the very first time, and people that have experienced before. Like, our system is set up that mental health issues only happen between 9 to 5, Monday to Friday. Outside of that, there's nothing, Mary Lou. It's very little services outside of accident and emergency. And anybody that's experienced going to accident and emergency for mental health will tell you that it's not a good experience. It's not the place where they need to go. There should be a 24/7 access to emergency mental health care, because that would make a whole lot of difference to people. And we have that laid out in this motion as well.
Well, that's absolutely an essential and a priority item. And as Mark has said, folks, this is not a party political issue. It is a political issue because we need the political system to wake up, to understand, and to respond to the real struggles that people are having, and to the reality that people are left waiting, sometimes waiting dangerously long times. And that has to stop. We talk about, you know, emergency responses in a public health emergency. We need emergency responses now, and Mark Ward's mental health motion sets out all of that. So we're just asking you, you know, of course, to leave your message or your idea or even your own story underneath this video. We'd like you to share this video to spread the word. But maybe the most important thing is to contact your own local political representative. Doesn't matter what party they're from or if they're an independent, and tell them that you want them to support this motion on Wednesday. And more than that, to ensure that this motion, the contents of it, that it's acted on, because that's what we need now. We need action, we need resources, we need understanding in the system that people are suffering and that we need to intervene now. So Sinead, folks, thanks for tuning in with us. Thank you, Mark, for all of your work on mental health and for bringing forward this really important motion. Wednesday is the day, folks, so make your voices heard and tell your local representatives that you want them to support this motion. Gurumila Mahaguf Galer, Agus Slán.